It all started in Vancouver, Canada, 1983. Dr. James McEwen works on the first medical robot ever, Heartthrob. Little did he know that he just started a chain reaction, that in the year 2012, 450,000 men and women alike will get surgery from the great-great-grandson of the Heartthrob, the Da Vinci robot. Rise of the Machines, Science Fact or Science Fiction by Abhishek Akula. In order to understand the concepts about to unfold, we need to understand some basic concepts, such as what is a robot, what do we think robots look like, and what was the first robot ever made? All these questions will be answered now. What is a robot? A robot is a machine programmed to carry out certain missions or actions. What do we think robots look like? What robots actually look like. Archytas made the first robot ever. The robot was a steam-powered pigeon made out of wood, and Archytas is not to be confused with Archimedes. Where does the word robot come from? The phrase robot was suggested in 1920 by Joseph Capet, whose brother suggested using the word roboti or robot to describe artificial creatures. Did you know there are 3 types of medical robotics, and that the 3 types of medical robotics are rehabilitation robotics, biorobotics, and surgical robotics? Dr. David Gao created the first bionic arm in 1998. It was made to help humans with severe disabilities to perform everyday tasks. This branch of robotics is called rehabilitation through the application of robotic devices. Because of rehabilitation robotics, we can now test the effect of a stroke on humans' hands. Biorobotics is a study of a robot simulating living organisms. Ben Finio and his team from Harvard actually make biorobots. He's made a bee attached to a wire that actually supplies electricity to the bee so it can fly. Surgical robotics, as you have probably guessed, is surgery using robotics. The Unimation Puma 560 was used to put a needle in the brain using CT guidance. The Unimation 560 was later disconnected due to safety issues. The Da Vinci robot has been reported with no lags in the system between the robot and the controller. The Da Vinci robot also has 3 to 4 arms that can be controlled by the main 2 master controls. Here is why robotic surgery is better than others. If you use a robot, you have smaller and fewer scars. You have a smaller chance to get infected, and you also have a quicker recovery. And you also have a quicker operating time and less complications. Miss Brendan Gordon said, quote, "I walked 4 hours after hysterectomy, which removed my uterus, ovaries, fallopian tubes, cervix, and what turned out to be 100 lymph nodes for pathologic study. I went home after 17 hours in the hospital and resumed a normal lifestyle." According to a recent Japanese poll, over 60% of Japan would actually prefer to have robots to care for them. A recent poll suggests that taking the Da Vinci robot for surgery is actually a really smart idea, because you'll be in the hospital for less days and you'll also recover a lot faster. In the TED Talk Robot in Action by Ivar Mendez, Mr. Ivar talks to you about how currently in remote places he uses a robot to communicate with nurses to give proper care. Mr. Ivan, using ultrasounds, can tell from any spot around the world and give diagnosis to save life. This is proof that in the future you could do surgery from basically anywhere around the world. In the TED Talk titled Medical Robots by Bradley Nelson, Mr. Nelson talks about using micro-robots to do surgery, and in fact they are currently testing this on pig eyes. Rights and responsibilities of robots. Medical robotics has a responsibility to stop any dangerous interactions with robots. Medical robotics also has the right to help the world become a better place.
You have to serve the patient 100% well. It is that we elect the patient.
Previously, a lab technician used to process each sample of blood. However, with robotics, several samples can be processed in a much more efficient way. Let's see how.
It's in a clock, and right here it's coming down to a barcode reader. It's spinning it, reading the barcode, determining the patient's name, their ID, and all that, and it's going to run it down the line and process it. And what it does is it'll automatically spin it down, separate the serum out of the red blood cells, and then it runs it. We have 3 analyzers going, and it will actually change here. The way this works is these detect the pucks. You'll notice each of the pucks has a metal ring on it. These are Hall effect sensors which detect that metal ring, so it can detect the puck is there. And then you have fiber optic sensors which emit light, and they can detect that there's a tube in that puck. And all of these sensors communicate back and forth with a PLC. A PLC is considered a programmable logic.
And if it wasn't for the line, we would have to have like 3 or 4 more people here. You know, it has helped kind of keep it efficient where you're not drowning in samples.
Robotic arms also help in the preparation of histological slides. Traditionally, pharmacists were filling dosages based on a doctor's orders. However, with robotics, robots can fill several orders in a short time. A robot can fill 40 to 300 prescriptions a minute.
Contains a number of cassettes. Each one of these cassettes contains medications. The medications are specific to the manufacturer and the dose and the dosage form. We request it. It will go through and produce package strips for each patient, and it will have the name of the drug on it. It will have the dosage form, the strength, when it is prepared, and it's important, the barcode, which is vital for the nurse to be able to administer. They can still perform so much faster than any human can. That it's, that's a nice, very nice, basically the elimination of the human factor. If you have technology in place and you have procedures and processes that require people to follow those processes, you drive out the human error factor significantly. Most of the time when we take a look and we see errors that have occurred, we will find it's not because of the technology, it's because somebody has failed to follow the process. Well, the patients, no matter how patients receive care, they still have the same right. They have the right to be treated with respect. They have the right to know how they're being treated, who they're being treated by, why are they being treated. Trying to think here, about 5,000 to 6,000 doses of meds a day. Could we do that manually anymore? Not with the staff I have. So, I mean, it's kind of we have changed our staffing levels based upon adoption of technology. And so right now we would be hard pressed to be able to push that out manually.